Hey, No Filter Moms, it's me, Christina. I am here with Charlotte Weatherby. She's my sister, but she's also a licensed professional counselor. She specializes in patients who have experienced trauma or dealing with emotional, mental issues related to trauma. And she also specializes in mood disorders. Today, we're here to talk about depression, specifically depression in women. Just a couple of statistics. About 12 million women experience clinical depression or are diagnosed with clinical depression each year.
Yeah.
And about 1 in 8 women will experience clinical depression in their lifetime. And generally the ages are that it most affects is 25 to 44. But there was another really interesting statistic you were sharing with me as well.
Yeah, which said that less than half of women will get treatment for depression in their lifetime.
And so a lot of that is, as women, being a woman is tough, just in general. But when you add in baby, job, husband, all those things, it can really add to the stress, the everyday stress of being a mom or a woman. And a lot of times, at least I can speak for myself, when you are feeling overwhelmed, tired, just, feeling like you want to cry all the time, sometimes that actually is depression. But I think we're so used to soldiering on and telling ourselves we're okay when really we need to be seeking some type of treatment.
Yes.
So could you share with us some of the common signs and symptoms with depression as a whole? We know there's different types,
Sure.
but just in general.
Yeah, one of the major signs is depressed mood, so feeling sad or down all the time or a lot, crying for no reason or what we would call crying spells, low energy, irritability. Some of the big signs that are noticeable are changes in sleep, so maybe sleeping too much or not sleeping at all. Also changes in appetite, difficulty concentrating or focusing, and also irritability.
Easily angered. Yeah, and sometimes a lot of those symptoms can be associated with a lot of other illnesses.
Yes.
Which is why it's really important that if you're feeling any of that, it's just best to see your doctor.
Yes.
See a therapist. Reach out to friends and family, right?
Yeah.
So if you're experiencing those signs and symptoms and you're going to your doctor, let's say, or a therapist, what would be some of the things that you want to encourage, the viewers to point out just to try to make sure they're on the right track?
Sure. So all the things I was naming, the doctor should ask about, but if a doctor weren't asking about it, I'd make sure to tell them about your changes in mood. So maybe you've noticed that you're now feeling depressed or down a lot, or crying a lot, or
And you just can't come out of it.
or not wanting to be around others. So you can think of it as a shift in your lifestyle, like maybe even not wanting to talk to or be around your friends, not wanting to answer the phone. Maybe even something that I've also talked to people about is maybe being impacted by social media. So noticing that things on social media bring you down or affect you.
Just everyday things you used to enjoy. It just makes you feel, it's not happy. You're not getting fulfillment out of it. Wow.
That's the main thing, losing pleasure in activities you used to enjoy.
Wow.
Yeah.
So then what about friends and family? Because, some people out there have really awesome friends and family that are very supportive. So the moment something changes, they're on it, or the moment that you express help, people are jumping in to help. But sometimes you have family who may be dismissive, saying you'll be fine. You're just going through a rough spot. It's okay. So how can you encourage our viewers out there to be able to reach out to their friends and family and let them know, seriously, there's something going on?
No, I highly encourage it. Unfortunately, there's a stigma attached to mental health or mental illness, but it's like any other health issue or diagnosis. It's very treatable. I encourage people to talk to family and friends, maybe even if you have a certain friend or family member you're close to let them know, no, something's not right. I'm not feeling the same. If you don't have that support, go see your doctor or get another opinion from a psychiatrist or a counselor, because information is knowledge, and unfortunately, because of the stigma attached to mental health diagnoses or depression, even I guess you could say society-wise or cultural, even different cultures, it's frowned upon.
So I know that you were saying that depression is like a medical illness, just like any other medical issue you could have. And so when we're thinking about treatment, so there's different forms of treatment for everything. Some medicine related and some not. And I know that some people like myself tend to stray away from medicine. I'm not against it, but we do. So what are some different treatment options that people can?
Sure. Sure. So, seeing a psychiatrist, which is a doctor that specializes in mental health conditions, can be very helpful. And not all psychiatrists pressure or force people to take medications. Also, talking with a psychotherapist, a counselor, or a psychologist. And there's different types of counselors and therapists who have different specialties or focuses. Sometimes people will seek assistance or support from their church.
Wow.
So, from a spiritual perspective. So there's a lot of varieties of treatment. Medications are very helpful for different people because sometimes the depression or the mental health diagnosis is related to chemical imbalances or the need for chemicals that make us feel good.
Yeah. And I think that's important that you bring that up because, you know, with my depression and I also have anxiety disorder, I have found non-medicinal ways of managing it. Although I will tell you, if it ever gets to the point, I'm absolutely not against taking, you know, medication. And so for you out there who may feel embarrassed by what you're going through and, you know, the idea of medication makes you feel like, I guess in some ways you're committed to this illness, I would just say whatever it takes for you to be balanced and be healthy, you do what you have to do. Yeah. So we know that there are different types, many different forms, I guess you would say. But specifically one of the things I wanted to touch on very briefly, because I know there is even a specialty for postpartum. But tell me, what do you know about postpartum depression? And I guess how is it different from other clinical depression?
Okay. Well, one, it would be a depression that comes after having giving birth to a child or childbirth. A lot of times, like we were talking about before with the chemicals, it can be very much related to hormones in the body. So if you think about when a woman has a baby, not only is the body changed quite a bit, but the lifestyle has now changed or shifted. So now there's a child in play. Change of all the way maybe
your day-to-day was, and
it's totally flipped upside down for a lot of people. And with those changes, because even though, you know, you could say there's this time period you're waiting for it, it's when it actually happens, it's not the same for everyone. Everyone's different. Everyone's body's different. And so it's and it's a type of depression that could, I guess you could say, like any depression, if untreated, can be detrimental or even dangerous. Because if you think of depression, the most danger would be the loss of a life, because depression can lead to suicide, which is why it's so important to get treatment or help.
Well, especially when you have a child involved, you know, when you think about postpartum, like you said, hormonally you're already imbalanced. And so in a lot of ways you're waiting to come out of this phase of depression and start to feel better about being a mom, about how your life is, you know, in its current state and its future state as well. But when you don't have that chemical balance to even be able to recover and have the demands of having a new baby and maybe even having other children, is really why it's important to not be embarrassed and not feel inadequate in terms of seeking help, you know, reaching out to family and friends. And like I said, if you have those family and friends that may not be understanding what you're going through, definitely taking time to talk to your doctor, specifically when you go for your OBGYN follow-up. But I have a couple of friends who have suffered from postpartum. And the blessing is that they've been very open about what they're going through, so they've been able to seek help. But I want to encourage moms out there, if you ever feel like you've been so excited, like Charlotte was saying, to have this baby, and the baby comes, and you're just not really connecting with the baby, with life, please go seek help. One of the things that you were saying about suicide in general is one of the things that generally happens when you fail to seek treatment is some people become suicidal.
Yeah, because like anything, if it's not treated, it can become worse. So depression untreated can be very detrimental. People slowly or dramatically pull away from others, isolate, and then also you can lose awareness of almost like reality of what, you know, an ability to make decisions, which is why it's so helpful to get treatment, and that you know, we want to prevent anyone from taking their lives or from seeking treatment. And sometimes it can feel like when you're meeting with a professional, a doctor, a psychiatrist, a therapist, that they're asking very intrusive questions. But just knowing that these questions are helping them to identify your symptoms, to identify what's going on, so the treatment can be provided
for the type of depression that you're experiencing.
Because everyone is different.
Yeah, and everybody's symptoms and how it affects their lives is different. I would say you could even be a functional depressive, if that's even a word, right?
Yeah, there's a form of depression which we call persistent depressive disorder or dysthymic disorder, which I guess you could say could kind of be phrased as functional depression, but it's almost like a low low level form of depression that's kind of consistent and always there.
Oh my
Yeah.
gosh, wow.
But again, it's treatable.
Yeah. So, do you mind sharing the National Suicide Hotline? Do you remember the number?
Well, the Georgia Crisis Line, which is a crisis line here in Georgia, is 1-800-715-4225. And then there is also a National Suicide Prevention Line.
And we'll look it up and post it. That's why I kind of made the joke, because I know she knows the Georgia one, but the national one, we'll look it up, and I'll make sure I post it in the comments on the video. But this is awesome. I mean, I really feel for so many women out there, including myself, who, like I said, society expects for us to be so strong, so stoic, push through all the problems that we're having. And really what it is that there's no shame in knowing that something's not right, and having self-care and a self-awareness to take care of yourself.
Yeah.
So we're so thankful for counselors like you and others out there. And we just thank Charlotte for being here today. No Filter Moms, we just thank you so much for joining us. Please check out our social media pages, Instagram, Facebook, Twitter, YouTube. Don't forget to follow us on Instagram and Facebook and Twitter, and subscribe to our YouTube page. Thanks so much for joining us.
Take care, everyone. Have a good day.
Yeah.